Hello, my name's Joe Savon. I'm the medical director for New Life Medical Addiction Services and also an owner as well. I started medicine in 1993 after training. I've been working in Marlton as a physician since that time. I was board certified in gastroenterology in 93, and I passed the repeat boards in 2003 and 2013. My board certification lasts until 2023. Around 2014, I became interested and concerned about what was going on in this country as far as substance abuse disorders. In my field in gastroenterology, I would have extensive dealing with people with pain management issues because we deal with inflammatory bowel disease. Inflammatory bowel disease encompasses Crohn's disease and ulcerative colitis, and those people have pain, and they need pain management skills on our part. Sometimes it exceeds our capabilities, and a pain management doctor is necessary, but we certainly are participants in the process. Also, alcoholism is a major part of what we do because gastroenterology encompasses liver disease. So I think after seeing what was going on and seeing the expansion of the problem, it made me very interested in addiction medicine. I am board certified by the American Board of Addiction Medicine, and that would be from 2015 through 2025. I'm also board certified by the American Board of Preventive Medicine in the subspecialty of addiction from 2018 through 2028. That's my academic credentials, which I feel comfortable about, but there's a lot more to me than just what hangs on the wall. First of all, I have been married for 32 years, and my children are grown now, but that was the best experience of my life, is watching my children grow up. As such, I really care not only about you as a patient, but family members that are involved. If something happens to my children or my family, I hurt, and I can understand why you would as well. So I think you put a lot into medicine, and when you put a lot into medicine, I think you get better results. We have had, with New Life Medicine, we decided we wanted to do something and try to make it as special as we possibly can. New life means what it says, new life, because people have had a disruption of their social network, of their families, of their occupations, and there's a lot of things that have happened in their lives that require adjustment. But part of it is old life, because a lot of people had a very wonderful old life until the addiction problem came about. So the bottom line is that bringing people back with the contacts that they used to have is a very important part of what we do, to reestablish relationships, reestablish community ties, and reestablish people in the occupations which they had in the past. So it's new life, and also with the concept of an old life. Prior to becoming addicted, do people have a medical problem? Maybe. Maybe they do, maybe they don't. However, actually, after the addiction process, then I think very clearly the disruption in neurocircuitry makes people definitely have a medical problem. When Nancy Reagan many years ago said, "Just say no," I think that's perfectly acceptable in the setting of somebody who has not used drugs. Once you start using drugs, then I don't think that's enough, and it certainly is not the option that we would want to pursue, because just as people would have hypertension, they would have heartburn, they would have any medical problem, we see this now as becoming a medical issue for which that we have to take care of that individual. And I think too often this field, substance use disorders, addiction has a judgment connotation. Substance use disorders would be the term that we would prefer. We are New Life Medical Addiction Services because most people don't know what substance use disorders are. So if we put that on our heading, people might not understand what we're doing. But we're dealing with something that I think is very important and has to have a medical component. Now, we're not downplaying counseling, because I think counseling is crucially important. However, you really have to put this into the purveyance of mainstream medicine. If you have chest pain, you go to a cardiologist. If you have an ulcer or liver disease, you go to a gastroenterologist. But if you have substance use issues, such as you failed a drug test, you have an issue where you think you're drinking too much, you are, you're having struggles with your family, what's important to you is being discarded because of the fact that you want to consume alcohol preferentially over the things that enhance the quality of your life, your occupation is sagging. Those are things that you would see us for, and we want to be the people that will take care of that problem. We are in a medical park, and we're going to offer services such as outpatient addiction services and outpatient counseling. We're going to have a strong component involving mental health disorders, and that's why we tremendously value the psychiatrist who's on our staff. I think that we have to deal with that component of people's overall recovery, because it's really hard to put together a puzzle. Well, it's impossible to put together a puzzle if you don't have all the pieces. And that's really the way that we see things. Now, again, what we want to do is we're providing outpatient services. Outpatient services are increasingly becoming the preferred way to provide these services. Now, people are sometimes ill to the extent that they need inpatient services. Our feeling is that we are not looking to provide every aspect of care, but we have people that we're working with, and we have affiliations for anything that we can't provide. There are people that can, and we will make certain that the people get placed in the proper modality for them to move forward successfully. But getting back to outpatient, what can we do with outpatient? The average outpatient stay is about 5 days. So if somebody stays here for 5 days, we're open 7 days a week. If you have to go through that process, that means that maybe you only have to take 3 days off from work. So that's a doable thing. We want to participate with all insurers, and we would like to be in network to the greatest extent possible. Our goal is not at this point to take your last dime or your family's last dime, and too often that's what happens in the addiction business. People have to mortgage their homes, and they do not get the results that are certainly not desirable, but sometimes almost abysmal. But we want to provide that service in a cost-effective way. We want to participate with insurers, and then we want to provide counseling, at least primarily to start, in the evenings. The benefit of the evenings, you can keep your job. You can see your children's baseball game. You can do things and still participate in our program. And so we really see this as a benefit to people that have, again, I cited the possibility of somebody having a failed drug test. If the company's going to want something from you, and so we can provide that in a medical setting, a medical office setting, with pain management. That's another big issue today. People are using narcotics for pain management, and there's plenty of evidence in the literature that non-narcotic management works better with less side effects. So those people have to come off their drugs. But coming off narcotics, it can be very difficult. But that's another thing that we want to be able to provide. And again, somebody says you go into a family doctor and you say, I tell you, I've been having about 6 drinks a day, and I'm a little worried about that. Or your doctor says, I'm looking at these labs here, and I'm not so sure you're telling me the whole truth about what's going on. Are you drinking more than you than you're telling me? And one of the sad things in medicine is most doctors don't even want to have that conversation. And if they have that conversation, they really don't know what to do about it. Where does that patient go? Does that patient go to the addiction place? Or, you know, is there an existing structure for that person to go make an appointment, get the care that they need, get put on the proper path, and then eventually get returned to the family doctor or the primary care physician, where they can go on, you know, with the continuity of care. So we're really looking in that direction. Those are the kinds of things that we want to provide, and I think that we can provide.